Something really screwy happened there. That video was out of whack to the point where I thought that the stream wasn't working at all. Anyway, good afternoon, good evening, and good night, people. Welcome back to, stream 28, 29, I think. What are we, 28? Stream 28 of Real Housewives of Canton Murder Edition, or as we like to call it, the Karen Reid Retrial. So we have about 20 minutes left of day 19. I understand day 20 was fairly boring, but that there's been some contention over how Bev's acted, and that now there's no court through till next Tuesday. So that that'll be interesting. But it does mean that I've got plenty of time to catch up, and given that I am running very, very friggin' late, we're just going to get stuck into it.
Do you expect this one?
Yes, sir. On Commonwealth, call Miss Christina Hanley to the stand.
Excuse us. Step up. Face the clerk and raise your right hand.
You solemnly swear the understanding of the court and jury in the case now hearing the truth, the whole truth, and nothing but the truth, so help you God.
Good afternoon. All right, Mr. Lally, whenever you're ready.
Thank you, Your Honor. Good afternoon, ma'am.
Good afternoon.
Could you please introduce yourself to the jury, spelling your last name for the court?
Sure. I'm Christina Hanley. Hanley is Hanley.
And Miss Hanley, what do you do for work?
I am a forensic scientist 3 at the Massachusetts State Police Crime Laboratory in the Trace Arson and Explosives Unit.
And where did you go to school?
I went to, I had received my Bachelor of Science in Chemistry with a concentration in forensics from Merrimack College.
And do you have any other degrees?
I do not.
Now, following your education, where did you first go to work?
I began working at the State Police Crime Lab in 2008 in the Drug Identification Unit. And in 2009, I transferred into the Trace Unit. And in 2017, I was promoted from a Forensic Scientist 2 to a Forensic Scientist 3 in the Trace Arson and Explosives Unit.
Could I ask you please to speak up, please?
Ms. Hanley, if it helps, that microphone is adjustable, so if you could get it as close to you as possible, that would be great. Thank you. The Massachusetts State Police Crime Laboratory where you work, is that accredited?
Yes, it is.
And by whom?
We are accredited by ANAB.
And what does ANAB stand for?
ANAB stands for ANSI National Accreditation Board.
And what does ANSI stand for?
Sorry, I can't remember exactly what ANSI stands for. I apologize.
That's okay. As part of that accreditation process, do you undergo any sort of proficiency testing?
Yes, I do.
And can you explain to the jury what that proficiency testing process consists of?
Sure. So proficiency tests are a quality assurance measure that's used to monitor performance. And I'm required to complete at least one external proficiency test per year, where I'm authorized to do casework in multiple subdisciplines. In my unit, I typically complete more than one proficiency test per year.
And what areas do you specifically undergo proficiency testing in?
Sure. So I'm authorized to do casework in multiple subdisciplines in Trace. So I complete proficiency tests in the subdisciplines of hairs, paint, fibers, glass, tape, and serial number restorations and physical magics.
Well, Jason, I gather that some real bullshit happened with the jury. Apparently, one of the jurors has actually been moved out of the foreman's seat, or should I say the seat that Bev invariably chooses the foreman from. Apparently he was talking with one of the other jurors and like Bev told him off or some shit like that. I don't know how legit that is. I don't know whatever else, but I'm inclined to trust Carney and Federo on that. What I want to know is who the hell taught all these people to go, sure, so in order to gather time and like get their thoughts in order or whatever else, I suppose, but it looks really bad. Bev was not happy after the 2-hour lecture. Well, I mean, it depends on what the content of the 2-hour lecture was. I'm extremely curious now. I mean, I don't know whether or not the sidebars from this one are ever going to get released, but I will go through them with a fucking fine-tooth comb if they do.
Examinations.
And generally speaking, what is entailed in those proficiency testing that you're given multiple times a year?
It's provided by an external company that provides the proficiency test, and I'm required to successfully complete one of those proficiency tests per year.
Now, have you successfully completed each of those proficiency tests that you've taken?
Yes, I have.
Now, what type of training or continuing education have you undergone at the State Police Crime Laboratory?
Sure. So I had internal training as well as external training. The internal training consisted of I had to complete required readings. I was required to complete some laboratory exercises, learn how to utilize the instrumentation in the lab. I observed other analysts in the unit working on casework. I was also required to...
Objection, Your Honor. We're just going to determine that the prosecution and the defense have stipulated all this shit, and I'm skipping ahead. I don't need to know about her qualifications and how she does what she does. I want to get to the evidence.
In
the testimony, you're a forensic scientist 3 currently, is that correct?
That's correct.
And what?
Sure. To their primary role or responsibility is
or exam.
I'm responsible for examining and comparing trace items that, for example, such as paint, glass, fibers, hairs, tape, miscellaneous items. I also perform serial number restorations on firearms and physical match examinations.
And what are your general duties and responsibilities within the trace unit within the lab?
So I'm responsible for the general operation of the unit. I train other forensic scientists within the unit. I also complete technical and administrative reviews of casework. And I my own casework in the trace disciplines that I previously mentioned.
Now, Ms. Hanley, you as a supervisor, you review other analysts' work within the trace unit, correct?
Okay, moving on.
It needs to be technically reviewed by an external technical reviewer because I'm the only one within my unit that can do certain types of casework currently. So we have to utilize an external technical reviewer at this time.
Now, with reference to physical match analysis, can you explain to the jury first just
observation to
analysis within the trace unit at the state lab? Is that general work supported by any sort of scientific principle or methodology that you're aware of?
Sure. So the benchtop as well as the tools that I'm going to use are all cleaned with a bleach solution on cross material. For example, plastics, glass, tape, etc.
Now, when evidence is submitted to your lab, how is it kept track of throughout its stay at the lab?
Sure. So when evidence is submitted to the laboratory, the case information is put into our LIMS system, which stands for Laboratory Information Management System.
And once it's assigned that number, how is it sort of tracked as it progresses through the different units within the lab?
There's a fucking custody log. Moving on.
Item is
what you do to begin your analysis.
Sure. So when an item gets scanned into my custody, after I've prepped my area to examine the item, I scan that item into my custody, and I will document that item with photographs. I will make notes of my observations. I will examine the item microscopically. If needed, I'll proceed with sampling and possibly additional microscopic examination and instrumental analysis.
Now, specifically starting with items of glass, when you take an item of glass to conduct a comparative analysis, generally speaking, what is the process for conducting such an examination of glass?
So it'd be the same process that I just mentioned. I would take that item, take photos, make any observations. I would proceed with, first I would check to see if there's any physical match comparison.
Sorry, I just got the notification through about Jen McRae's question. Wondering whether or not if found not guilty, whether or not the O'Keefes will need to drop the wrongful death lawsuit. The short answer to that is no. Civil cases obviously have a much lower standard, being either the balance of probabilities or the preponderance of evidence. So, long story short, no. You can definitely be found liable of having committed a act that created a civil wrong against somebody without being found guilty of having committed the crime. They are two different systems for a reason. I mean, for the most specific example of that I think I can give would probably be Mr. Donald Trump and E. Jean Carroll. Actually, that may be a bad example because I didn't 100% follow that case. I don't believe he was convicted of rape. Well, no, he wouldn't have been. But that judge, I know that a judge in a civil case found that he had allegedly engaged in said actions, and therefore she was entitled to call him a rapist. So that's the difference between your criminal and civil systems. Is that yes? Long story short, it will make them significantly hard. It will make it significantly harder for them, but they will need to prove to either a judge or a jury on the balance of probabilities being 50.1%, or the preponderance of the evidence, which my understanding is closer to 60%, that she did it. So unfortunately, Karen is not out of the woods in this. So.
And then, if needed, I would
there you go.
take any samples to examine it microscopically and or instrumentally.
And that general process that you've just described is the items that you tested in reference to this case or analyzed in reference to this case. Is that the process that you followed in this case? Yes. Now, what kind of instrument?
I hate to say it without showing my ignorance, but I generally didn't watch the OJ trial with Jeff. Just because there were on nights when he did the OJ trial, generally it was a night that I had to travel. And I know next to none of the details of the OJ trial. Might be an excuse for me to go back and watch it.
Instruments do you use? Starting off with items of glass, what kind of instruments do you use to conduct that analysis?
Sure. So I'll use a stereo zoom microscope to initially examine it microscopically. If I take samples to do additional microscopic examination, I'll examine it under a polarized light microscope. And then if I need to take samples to do instrumental analysis, that would be using our, it's referred to as a GRIM, which stands for Glass Refractive Index Measurement. It's an instrument that measures the refractive index of glass.
And if you could, please explain to the jury, what is a refractive index?
Sure. A refractive index is a measure of how light bends when it passes from one medium to another.
And how are you viewing that utilizing the GRIM device when it comes to glass?
So a sample is prepped on a slide, and it is placed on a hot stage of the microscope of the instrument, and the oil that the sample is in it goes through a cooling and a heating phase, and as it's going through a cooling and a heating phase, it passes through what we refer to as a match point. So you can make that observation as the sample is running. And then when the sample is done running, it takes an average and it calculates the refractive index of the sample through the calibration data of the instrument.
And what is an FTIR?
So an FTIR is a Fourier transform to analyze certain types of samples. Essentially, a sample is exposed to infrared light, and your sample reacts in a certain way to it, and it produces a spectrum or a graph of peaks and valleys, and it is representative of your sample.
And how is that FTIR instrument, how is that used in this type of physical match analysis?
So actually, the FTIR was not used for physical match examination.
Oops.
Now, you mentioned it a little bit earlier in your testimony. What is a polarized light microscope?
So a polarized light microscope it's a microscope that just has a couple of filters in it that we use to look at samples at a higher magnification and make observations of certain optical properties of samples.
I saw that, Jason, and the best comment that I saw so far was fucking Chrissy Mayer. Bonnie Blue arrested for smuggling thousands of DNA samples.
And how are you utilizing that instrument in your analysis in the lab?
So it's used to examine various different types of samples, paint, fiber. We can also look at glass.
Now, do you document your work as you perform your analysis in the lab?
Yes, I do.
Now, Ms. Hanley, at some point were you assigned to perform some work on a lab case number 22-02184 pertaining to this defendant, Karen Reed?
Yes, I was.
And what type of work were you assigned to do in this case?
So I was given items for physical match comparison of some glass items, as well as some instrumental analysis of the glass. And I was also given items for some items of plastic for comparison.
Now, starting with glass pieces, do you recall what item numbers you analyzed pertaining to the glass pieces?
Yes. So I examined items 3-2, which was a clear glass cup with broken irregular edges. I was also given item 3-3, which was 5 pieces of clear glass with broken irregular edges from the bumper of the vehicle. And then I was also given item 7-12, which were clear and glass pieces recovered from the road. And I was given also 7-14, which was a clear piece of glass recovered from the road.
And now if we could, Ms. Hanley, just break those down sort of one by one. So starting with item 3-2, what was provided to you in reference to a description of what that item was?
Sure. So item 3-2 was a clear glass cup with broken irregular edges, and there was dirt debris on the exterior and interior of the cup.
Now, did you measure that item?
I did.
And what measurements did you obtain from that item, the drinking glass?
I just would need to refer to my report for measurements.
Okay, you can do that. You have your report right there. Go right ahead.
Thank you, Your Honor.
So the diameter of the bottom of the glass cup was 2 3/4 inches, and it measured approximately 2.5 inches in height.
On your bed for
You mentioned that there was debris on both the interior and...
Wait. Hang on. Why is she reading directly from her report? Has it been entered into evidence? Oh, of course. I'll allow it.
exterior of the drinking glass, is that correct?
Yes.
Now, turning your attention to item 3-3, what was provided to you as a description of item 3-3?
Sure. So item 3-3 consisted of 5 pieces of clear glass, all with broken irregular edges.
And was there anything provided in the description of where those 5 pieces of broken glass were located?
Yes, they were recovered from the bumper of the vehicle.
And was there any identifying information provided to you as far as in reference to that vehicle?
The only other description of the item is the license plate of the vehicle.
What was the license plate that was provided?
So it was MA3GC684.
And did you measure each of those respective items?
Yes, I did.
Now, as far as before we get to the measurements, Ms. Hanley, when it comes to a lab item number, say 3-3, that has multiple pieces to it, how are each of those individual pieces then subsequently labeled?
So sometimes we'll subsequently label them with a lettering system.
And as far as these particular pieces contained within item 3-3, the pieces of glass from the bumper of the defendant's vehicle, how were they labeled?
So these were labeled A through E.
And with reference to the measurements, what measurements did you obtain from the pieces within item 3-3?
Sure. So I measured the largest and the smallest, and the largest measured approximately 7/8 of an inch by 5/16 of an inch, and the smallest measured approximately 3/16 of an inch by 1/8 of an inch.
Now, with reference to the drinking glass, you examined that microscopically, is that correct?
I did, yes.
And with reference to these items from item 3-3 from the bumper, you examined those microscopically as well, is that correct?
Correct.
And was there a particular piece from the pieces from the bumper that you did any additional examination of?
Yes, I did.
And what instruments did you use?
See, I'm just incredulous about this whole thing, though. When you actually sit back and think about it logically, which I know it's Bev's court, you're supposed to, what is it? Suspend all disbelief. But here's the thing. Even if he was hit by that car in reverse, how the hell do shards of glass and a single hair stick to the car through a blizzard? Like, to me, that just doesn't seem plausible. Oh, these pieces were recovered from the bumper. Were they, though? I mean, all we're going on is the word of the troopers, isn't it? Did they actually take photos of where the pieces of glass were recovered from? And I'm sorry, I refuse to believe that a curved piece of glass, because it's from a cocktail glass, it's going to be curved. It's not going to adhere very well to bumper. Whilst I agree that hair sticks to a lot of things, Cheryl, I don't think that a single piece of hair is going to adhere to a car in that manner. Not the way that they push it. It doesn't gel with me in my mind.
And which piece?
Sure. So there was one piece, I sampled piece E that I labeled as piece E. And I took a sample for examination under the polarized light microscope and a sample to analyze it instrumentally on the REM instrument.
Now, turning your attention to item 7-12, what was provided to you as a description for item 7-12?
Sure. So item 7-12, that consisted of 5 pieces of clear apparent plastic and 9 pieces of clear apparent glass with broken irregular edges.
Now, the 9 apparent pieces, well, let me ask you this first. As far as the description that you were provided, was there any description as far as where those items were recovered from?
Yes. Those items were recovered from 34 Fairview Road.
And is it your understanding they were recovered from the street or the roadway outside of that residence?
It just says recovered from 34 Fairview Road.
Now, as far as the 9 pieces of clear apparent glass from item 7-12, were those similarly sub-labeled as the previous item 3-3?
Yes, I received those labeled with the lettering system. They were labeled A, B, C, D, E, F, I, K, and L.
And with reference to those 9 pieces of glass, did you examine those microscopically as well?
I did, yes.
Now, turning your attention to item 7-14, what were you provided with as far as a description of that item 7-14?
So this item consisted of 1 piece of clear glass with broken irregular edges.
And similarly, was there any description provided as to where that item was recovered from?
Yes, it was recovered from 34 Fairview Road as well.
And again, how many pieces were contained within that item 7-14?
7-14 was just 1 piece of glass.
And did you measure that item as well?
That item, I do not have the measurement of. It was examined by a previous analyst within the unit, so that measurement was taken at that time.
And that other analyst would be Mix Valier, is that correct?
Yes.
Okay. And as far as your examination of that item 7-14, what type of instruments did you use to examine 7-14?
So I sampled 7-14 to examine it under the polarized light microscope, as well as to analyze it instrumentally using the GRIM instrument.
Are you familiar with a term called a class characteristic?
Yes.
Can you explain to the jury what that is?
Sure. So a class characteristic is when a material can be associated with a group of items that share characteristics.
And what is an individual characteristic?
An individual characteristic is when a material can be related to a single source, such as a physical match.
And so what is the difference between a class characteristic versus an individual characteristic?
So class characteristic is that it can be associated with a group of items that share characteristics, versus the individual characteristic. It's more individualizing. It can be related to a single source, just in the case of like a physical match.
And what is a physical match?
So a physical match is if an item is broken and those pieces are compared to each other, and they're broken irregular edges fit back together, and they have a jigsaw fit, that would be considered a physical match.
Now, can you please explain to the jury the steps and the process that you undertook in your comparative analysis of items, specifically of glass in this case?
Sure. So I first did a comparison of all of the glass pieces and the glass cup that were recovered from the road. So those were items 3-2, 7-12, and 7-14. So I examined all of those to determine if there was a physical match between any of those items first. There were, I believe, 6 pieces of glass from item 7-12 that fit mechanically to the cup that was also recovered from the road, item 3-2. After I completed that examination, I then did a comparison to see if there was a physical match to some of the 2 of the glass pieces from the bumper. And there were 5 total from the bumper. 2 of them I used for physical match comparison. And there was no physical match comparison between those 2 pieces from the bumper, item 3-3, compared to the glass pieces and the cup that were recovered from the road. And then I sampled.
Hang on, Rich, how are you up? Wow, that was really bad. The redemptions aren't working at the moment. I didn't have time to set it up this morning. I will give you your 50 points back later. Remind me.
As I had mentioned earlier, one of the pieces from the bumper to do further microscopic and analytical analysis on, and did a comparison with one of the pieces from the road.
Can I see counsel at sidebar for just a minute, please?
Oh, okay. I'm guessing this is the beginning of the end, because we can't be too far away from the end of the stream for day 19. I did have to laugh, though. I saw someone absolutely flip their shit, because I haven't seen this chick. Someone in chat before said that she was attractive, but I haven't seen what she looks like, aside from a single photo that someone posted on X with the caption, "I'd hit it, I'd hit it, I'd hit it." And someone absolutely lost their shit and actually said, "You're a monster. That's even more inappropriate than the text messages that Proctor was sending." I'm just like, fucking oath, no, it wasn't. Like, honestly, some people need to grow a sense of humor. Because, particularly in murder trials, if you don't have at least a little bit of a dark sense of humor, you ain't going to make it through. Especially not with this trial. Jesus. The only person in the trial not hit with the ugly stick so far. I mean, look, as far as I'm aware, there's a few women who have their panties dropping for Alessi.
I'm going to ask you to come back tomorrow, but a little bit later in the day. And...
Which, to be honest, if he actually is 67, he's doing fucking well for himself. Okay, so that was the end of the sidebar. She's saying we're going to get you to come back tomorrow.
All right, so folks, we're going to end for today. Please do not discuss this case with anyone. Don't do any independent research or investigation into the case. If you happen to see, hear, or read anything about the case, please disregard and let us know, and watch your social media use. Thank you. So Ms. Haley, after the jury trial.
All rise to the court, please. No folks follow me.
Now, was there anything after the jury
Goodbye.
left? I'm guessing not. Adara the Wholesome, hello. Wow, thank you so much for becoming a new member. I know that name. Wait, you're in the Vice Squad. I knew that name.
Right, well.
Okay, we're back on the record. Oh, fuck off, really?
You don't need me for anything, right? We're all set?
We're all set. Thank you.
Fucking tease. Are we catching anything on a hot mic here?
We can leave those. Nothing they're going to get from that.
Apparently not. Sorry, the remote doesn't have a next video button, so I did queue up day 20. Hopefully it's just going to go straight into it. Hmm. 2 hours of your life you can't get back. Oh, was it seriously just a fan for 2 hours? Jesus, that is a hell of a sidebar. Alright, look. Hopefully we're just about there. Oh, there's the huffing. She's huffing, ladies and gentlemen.
Please be seated.
All right, so jurors, I still have a couple of questions for you. Were you able to follow the instructions and refrain from doing any independent research or investigation into this case? And we've discussed the other 2 questions, but I do need to stress for you that it's very, very important that no one discuss this case. Don't let anyone talk to you about the case, no comments about the case. You've seen how hard the lawyers have worked to pull this case together for you, and everybody's given it so much time. So please, let's make sure that we follow that. That means each other. So With that, I know we're late getting started. We're going to take an abbreviated lunch today, only 30 minutes, and abbreviated breaks. So no morning break. We're going to start now and go till 1. All right, Mr. Brennan, and we're taking a witness out of order. I apologize. We've got a witness here. Sometimes we take witnesses out of order. Ms. Hanley will be back later for the rest of her testimony, but we've got a witness here that we'll call out of order. Thank you. Mr. Brennan, thanks.
Thank you, Your Honor. Commonwealth calls Dr. Wolf.
I completely understand that, Adara. Well, welcome. You'll find if you want to stick around, you'll more than likely find a good home here. It's entirely up to you, though.
And now step up to face the court. Raise your right hand, please.
You solemnly swear the evidence of the court and jury in the case now and here to the truth, the whole truth, and nothing but the truth, so help you God.
I do.
Thank you.
Good morning, doctor.
Good morning.
All right, whenever you're ready, Mr. Brennan.
Thank you, Your Honor. Good morning, sir.
Good morning.
Could you please introduce yourself to the jury, spell your first name and last name for the court reporter?
Sure. My first name is Isaac, A-I-Z-I-K. It's phonetic. Last name is Wolf, W-O-L-F, like the real thing.
What do you do for a
Dr.
living?
Wolf.
I'm a brain surgeon.
Is there a special part of medicine that you study?
Well, my main interest in brain surgery is
Okay. I'm just like stupid question here. I get we're taking a witness out of order. I'm still surprised. They're throwing Dr. Wolf into the mix, and the other chick hasn't even finished part of her testimony. Oh, well, I appreciate that, Adara. Well, don't stress.
brain tumors and trigeminal neuralgia. But I also specialize in movement disorders. I do pediatrics and adults.
Are you an active working neurosurgeon?
I am very active working neurosurgeon. I get up every day at 4:30 in the morning to go to work, 5 days.
Oh my fucking God. This guy, I swear to God, this is the perfect setup. Someone needs to take some snapshots of this guy and Brennan and caption the joke about the doctor on the stand. When the lawyer says to the doctor, "Oh, so you performed the autopsy?" "Yes." "Well, how were you sure that he was dead?" "Well, his brain was sitting in a jar on the table next to me." "But how could you be sure that he was, but he could still have been alive?" "Well, yes, I suppose he could be out practicing law right now."
Days a week. I take call 300 days out of 365 days a year.
Did you work yesterday?
Yes, I did.
What type of work did you do yesterday?
I did 2 brain surgeries yesterday.
Are you working tomorrow?
I have 4 surgeries scheduled for tomorrow, which is why this is a little bit delayed for me, and I have 4 on Friday.
And what type of surgeries do you have tomorrow and Friday?
I have 3 brain tumors, 1 trigeminal neuralgia, and on Friday I have 4 patients with movement disorders.
You're here today as a witness. How much of your practice, how much % of your income is from being a consultant or a witness for a case?
Probably less than 1%. I don't do this for a living.
I want you to take us through some of your education and background. Could you share with us where you went to medical school and where you graduated from?
I went to Yale Medical School. I graduated summa cum laude.
Was that in 1981 that you graduated?
Correct.
After medical school, did you begin internship?
I can't. I'm just after that other reject. I'm expecting everybody to have their graduation or completion of their degrees to be questioned. I kind of feel like it's superfluous with this guy though. He seems legit.
Internships in medical residency?
I did an internship at Hennepin County Medical Center, which is a trauma center in Minneapolis. I then did 5 years of neurosurgical residency at the University of Minnesota.
And was that in Minnesota?
Correct, in Minneapolis.
Is there something about that hospital that has some specialty?
It was one of the #1 training centers for chairmen in neurosurgery at the time.
Did you, in your residency and in your fellowships, do any work or study in pathology?
During your residency as a neurosurgical resident, you do 6 months in neurology, you do 3 months of neuroradiology, you do 3 months in pathology, which includes autopsies on brains. And then you do rotations through a trauma center as a chief resident, through a VA hospital, and then ultimately at the university hospital for elective cases. We also do 6 months of pediatric neurosurgical residency.
Did you do a fellowship
at New York University.
Yeah, at NYU, I did a fellowship before I went to the University of Maryland as a professor in brain transplantation. The interest was in using cells to create dopamine centers in rat brains with the concept of Parkinson's being curable with transplantation.
I'd like you to take us through some of your faculty positions, and so you can share with us some of the progression of your training and experience. And did you begin at the University of Maryland Hospital?
Yes. In 1987, the University of Maryland recruited me to start their epilepsy surgical program and skull-based program. And then part of our responsibilities as assistant professors was to cover shock trauma.
Could you explain for us what shock trauma means and whether the University of Maryland Hospital was a shock trauma hospital?
So the University of Maryland and shock trauma were actually two separate entities when I started. A man named Cowley had basically developed the concept of the golden hour. So prior to Dr. Cowley, most trauma was just taken locally. That meant as a community hospital, if a patient had been in a motor vehicle accident, they needed an orthopedic surgeon, they had to call the orthopedic surgeon in. Could take 15 minutes, could take 3 hours. The same thing for a vascular surgeon, the same thing for a neurosurgeon. Dr. Cowley came up with the concept that you needed a center that was strictly for trauma, and every attending had to be in the hospital 24/7. So that was the concept of shock trauma back in the 80s. When I got there, we were transitioning from a very small center to a 125-bed hospital that was completely committed to trauma.
In that experience, in the years you worked there, did you have an opportunity to treat a number of people with brain injuries?
We treated well over 100 patients a month, basically, with brain injuries at shock trauma, along with spinal cord injuries.
Did you perform surgeries in different types of brain trauma and brain injuries?
Yes.
After Maryland in 1993, did you move to Miami Neuroscience Center?
Yes. In 1993, I left academics. I went into private practice in Miami, and I started the Miami Neuroscience Center. We were the first private community hospital to have what's called the Gamma Knife. So we were the 13th in the country, but the only one that was non-university based. And Gamma Knife radiosurgery is using radiation to operate on the brain.
Are you presently the director of the Miami Neuroscience Center at Larkin Hospital?
Yes, I am.
Do you conduct a number of surgeries a year there?
Correct. So I spent 19 years at Doctors Hospital, and then we moved to Larkin Hospital 13 years ago, developing the new radiosurgical unit called ZAP, and also another fancy machine called high-frequency ultrasound to treat the movement disorders.
You've noted that you have a number of professional memberships. I don't want to go through all of them. I'd like to point out a few. Are you a professional member of the American Association of Neurological Surgeons?
Yes.
Are you a member, a fellow American of the College of Surgeons?
Yes.
Are you a member of North American Skull-Based Society?
Yes.
And is that brain-related?
It is.
Are you a member of the Society for Neuro-Oncology?
Yes.
Are you a member of over, or at least 34 different professional memberships?
Yes.
In your career, have you engaged in research?
Yes.
Has that research focused or centered on brain injury?
Yes, it has.
Is some of your research as a principal investigator for THAM treatment of brain tissue acidosis in severely head-injured patients?
Yes.
Did that research and as a principal investigator help you in your diagnosis and treatment of brain injuries?
It actually was in the treatment of severe head injuries, patients who are unconscious, the concept of trying to relieve the increased intracranial pressure that occurs from the injury and to increase blood flow, thereby increasing oxygen to the brain.
Did you also serve as principal investigator for research for the PEG SOD in severe head injury?
Yes.
Could you describe that very briefly?
Basically the same, one of the biggest problems in brain injury is the fact that blood flow ceases to exist as the brain swells up. And so one of the things we try to do is preserve the neurons by making sure that they have enough oxygen and blood flow to them. All these are agents that try to assist that.
I won't go through all of your research and principal investigator roles, but I want to ask you about one more. And that is, did you serve as principal investigator relative to the IRB protocol for brain pathology?
Yes.
And what did that do? What was that about?
It was about looking at what happens after a brain injury to blood vessels and tissue as the intracranial pressure increases in the brain.
Have you been part of publications of a number of different books?
Yes.
I won't list parts of all 16 books, but can I point out a few?
Sure.
Were you the author of a book chapter regarding head injury, difficult medical management?
Yes.
Were you the author of a book chapter on pediatric neurosurgical emergencies?
Yes.
Were you the author of a book chapter on complications of head injuries in adults?
Yes.
Were you an author of a book chapter imaging of craniocerebral trauma?
Yes.
Were you an author of a book chapter in emergency room assessment of the head injury patient?
Yes.
Were you the author of a book chapter intracranial injuries?
Yes.
I won't list or ask you about the other book chapters that you've been the author of. Have you been involved in journal articles?
Yes.
I'd like to ask you just about a few of the 70 journal articles that you have published.
Your Honor, objection.
So do it. Go ahead and ask the question without a comment, please.
Were you an author of a journal article, Intracranial Pressure in Non-Traumatic Ischemia and Hypoxic Cerebral Insults?
Yes.
Were you the author of a journal article, Post-Traumatic Cerebral Infarction?
Yes.
Were you the author of the journal Fractures of the Clivus?
Yes.
Could you tell me a little bit about that paper?
We used thin cut CT scans to identify fractures of the skull base.
Okay, I will perfectly admit this guy is extremely qualified, particularly in relation to treatment of brain injuries. But my question here is going to be, what is he being offered for? Like, is the whole purpose of this to go, oh yes, he's so incredibly qualified with brain injuries that he reviewed the scans of John's brain, and as far as he's concerned, that has to have been caused by a vehicle collision? Because bad as it sounds, I'm not sure, like, this guy is amazingly qualified, but I'm not sure that that falls within the scope of his abilities. Like, that's still speculation. I'm curious to see exactly what happens here. Oh shit. The video die? Well, fudge, I guess I'll just sit here and talk to myself then. He disagreed with the forensics neurologist, says that John's injury wouldn't have immediately incapacitated him. What? So this is them trying to say, oh, he got hit by the car and still could have locked his phone? Okay. Maybe. Interesting. Did I mess up or something? Like, did I move the stream by accident? Well, I mean, I didn't think that I didn't think that they stopped talking during the side. Like, sorry, I didn't think that what he said warranted a sidebar. So I'm just trying to work out if I messed up and moved the stream by accident.
at one of the pieces firm, and I believe broken irregular edges.
It must have. What the
Dash
fuck?
2 was a
I'm so freaking confused right now. Like, did Lauren cry? Did Court TV's feed fuck up? All right, hang on. Okay, so where were we? We were. Yeah, so we were listening to this guy, and then suddenly they go on a sidebar break, and it goes back to her.
Of his right upper eyelid.
I am aware that the ME described that. Yes, sir.
Now, could Your Honor,
What type of work did you do yesterday?
I did 2 brain surgeries just from the injury and to increase blood flow, thereby increasing oxygen to the brain.
Did you also serve as principal investigator for research for the PEG, SOD, and severe head injury?
Yes.
Could you describe that very briefly?
Basically,
Patient.
yes.
Were you the author of a book chapter, Intracranial Injury, Intracranial Pressure in Non-Traumatic
Fractures of the skull base prior to clearly, and so we classified them and delineated them in the paper and discussed the
clinical and radiographic features?
Yes.
Am I pronouncing that correctly?
Clivus.
Thank you. Were you the presenter in acute head injury?
Yes.
Over your career and your study and your clinical experience,
I think I'll have to do
brain injuries.
Yes.
Are you familiar with a number of different types of brain injuries?
Yes, we still treat them.
Were you asked to review materials relative to this case?
Yes.
And do you recall the materials that you reviewed?
Yes.
Could you share with us some of the materials that you reviewed?
I reviewed the chief medical examiner's assessment of the case. I reviewed pictures that I'm assuming the medical examiner took of the autopsy, and I reviewed the report from the forensic pathologist.
And before I ask you about your review of specific materials and your opinions in this case, is there a benefit to your clinical experience in studying brain injuries as opposed to the experience you had as a fellow simply with pathology?
Well, I think that for the jury to understand is a clinician understands the process from the time the injury occurs till the patient either leaves the hospital or dies. And it's a process. And as a neurosurgeon, I have a tremendous amount of experience with that, if that's what you're asking me.
Yes. And so, doctor, you reviewed a number of items of information in this case. Did you have an opportunity to review photographs of a laceration to Mr. John O'Keefe's head?
Yes, I did.
With the court's permission, I'm going to ask to display Exhibit 160.
Okay.
Dr. Wolf, I'm going to ask you to take a look at this photograph. Have you seen this photograph before?
Yes.
I want you to explain to us what you're seeing here and take us through the process of your observations.
Well, what we're seeing is an approximate 1.5 inch laceration with bridging tissue and contusions and abrasions. To us, that's just a classic blunt trauma injury. There's nothing other than just vanilla about it. This is what happens when soft tissue hits a solid ground. The skin tears apart a bit, but not through and through. As you can see, there's the bridging. You can see all the bruising or contusions and just the tear, a little bit serrated along the edges.
Thank you. If you could take that down. Dr. Wolf, as a result of that wound, did you have a chance to further look at information provided to you about the actual inside?
See, I will admit, this annoys me, though. I understand why it's difficult to get a hold of him and put him on the stand and make sure that he's available, given the life-saving work that he does. But I will say this, it's frustrating because they really should have, well, I mean, no, never mind, because the defense has the rebuttal. Never mind.
The skull of Mr. John O'Keefe.
Yes, it was the pictures that I was reviewing showed a non-depressed skull fracture extending linearly through the clivus and into the frontal fossa of Mr. O'Keefe over the orbital roofs. He had fractures along the temporal fossa as well. So it was a classic linear basilar skull fracture.
Is basal skull fracture a characterization?
It's basically the base of your skull is what it encompasses. So the opening at the very bottom is what we call the foramen magnum. That connects your brainstem to your spinal cord. And then as your brainstem goes up, it goes into the different skull areas that, talk about what we call the cerebral cortexes, your occipital lobe, your temporal lobes over here, and then your frontal lobes.
So can you walk us through what happens when someone incurs this type of injury to the back of the head, how it happens, and what are the next steps for a person?
So what happens is, you fall backwards, and the linear acceleration starts to take you back down with gravity. The skull hits the ground. It gets, in layman's terms, smashed a little bit. And then the brain moves forward as a response to that. And it moves forward because you have cerebral spinal fluid and because you have the deceleration, acceleration again. As it does, your skull, if you were to look inside your skull, it's like mini mountains along your temporal bones and your frontal bones. So the brain is being thrust forward at a fairly good speed, and it's getting bruised. You can think of it as if you took a hammer to your thumb. It's really turning black and blue. Those are the contusions. And so the temporal poles and the frontal poles are getting contusions because of that. At the same time, you have a space called the subarachnoid space. And I'm sure they're going to hear about the subarachnoid hemorrhage. And that space is it's very clear, thin membrane that covers all of your brain and all of your spinal cord. And normally, you really don't see it unless you open up the brain and you're operating. But when you either have a traumatic event like this, where little vessels are pulling apart underneath that membrane, or, for example, the classic, when you have an aneurysm burst, the space that the aneurysm bleeds to is the subarachnoid space. The other thing that occurs in trauma like this is you can get a subdural. So the dura is the membrane that covers the whole brain and also right down your spinal canal. And it's a very thin membrane that looks like very thin leather. And in that space between the brain and the dura can be a lot of veins that go towards a central vein called the sagittal sinus. And if those tear, you have a venous hemorrhage from, which is not arterial, so it's not quick, but that can develop into a subdural as well. If you tear a portion of your brain as well, and you get a little arterial bleeds, that could create a much faster subdural hematoma. And so when you look at the pathology, the autopsy of his brain, you're looking at a subarachnoid hemorrhage, you're looking at a subdural hemorrhage, neither one of them which was huge or would have required surgery, as well as the contusions that I described in his frontal poles, in his temporal poles, and then the original bang, which was in the occipital area. These are all findings that you would see on a CT scan and an MRI scan without requiring an autopsy if he had made it to the emergency room.
I want to take a step back at the beginning.
So his head injuries weren't fatal, is what you're saying?
Laceration on the back of his head was caused by a fall. Could this be caused by a fall landing on hard ground?
Yes. I mean, like I said, it's a classic blunt trauma laceration.
Do you have an opinion to a reasonable degree of medical certainty whether this injury, the laceration and the basal fracture, was caused by Mr. O'Keefe falling backwards on the ground?
My opinion is that that's what caused his whole injury.
The pattern of the laceration, do you have an opinion whether that is consistent with hitting the cold, hard ground?
Objection, Your Honor. Can we have sidebar on that, please?
So I'm sustaining the objection, so no sidebar.
Your Honor.
Do you have an opinion, doctor, about whether that laceration on the back of his head was caused by a particular movement?
Well, the only
Alright,
way
you
he
become a member
could get
again?
this kind of injury
How
was
the hell
to
does
fall
that work?
backwards, hit the back of his head, and then the resulting, energy forces going into his brain and to his base of his skull.
Would that type of laceration require Mr. O'Keefe to have hit a line type or ridge type object?
A ridge type of object?
Yes.
No, I mean, like I said, the tearing of the skin in that fashion, you can look it up, would be
okay.
just
Well,
a
thank you.
classic
Appreciate
blood
it.
trauma injury.
Is there anything about that injury that would suggest to you it had to have been something sharp or ridge-like to cause?
Objection, Your Honor. Again, request kindly a sidebar on this.
All right, we'll come to
Thank you.
Oh, she didn't want that to go to sidebar originally, but now it has to. Looks like Brennan's trying to torpedo the whole, he might have hit a weight, or he might have hit something inside the house, like a coffee table, or... Yoda seems to know what he's talking about, though. I feel is better. Like, hands wouldn't have required surgery or anything like that. He was still clearly unconscious on the ground. And if the cause of death was hypothermia, that's why you can't rule it a homicide. So is this them? Has Brennan given up on murder 2, and he's basically just going for the vehicular manslaughter and saying, oh, well, if she hadn't driven away, he might have lived? Like, I'm curious. Yeah, why's my remote died? I would love to be able to fast forward through this, but my remote has died. So give me a second and I'll try and come up with something a little more entertaining to talk about. But, where are we? Trying to reset the remote. Come from a squad down under. The down under squad. Oh, well, there you go. No problem.
So as we were discussing, Dr. Wolf, you said this is a classic fall backwards. Is there anything about the pattern of that laceration that would suggest that there was a ridge or a line type edge that caused that wound?
Not necessarily.
And have you seen, in your experience, similar types of lacerations and breaks caused by falling on hard ground?
Yes, you can see that both in the occipital region. You can see it if patients fall on the forehead. The skin tears, they're still bridging, and then they get bruises.
Some of your work was in Minnesota.
Correct.
Was it a colder part of Minnesota?
Very cold part of Minnesota. It's Minneapolis.
I'm sorry. Did you often see these type of injuries there?
Yes, I mean, we took care of a trauma center, Hennepin County.
Well, that's
very frequently patients that are drunk fall down on ice sidewalks and could develop, lacerations in their head, epidurals, which are blood clots above the dura because they fracture a bone in the temporal area and they can get a bleed from a fractured artery. And it happens when people are shoveling snow and have a heart attack and fall backwards. So there are various ways that people fall, resulting in head injuries and lacerations to their forehead or to different areas of their head.
Can somebody suffer this type of injury simply by falling backwards?
Absolutely.
You had taken us through the process of falling backwards and then talked about what happens to the brain. Can I ask you a couple of detailed questions about that?
Sure.
When you explained that the brain upon impact then shifts forward and hits the front of the skull. Is there a medical term for that process?
Well, the medical term is a coup counter coup injury. So the coup is when you first hit. In this case, it was the back of the head, as summarized by the laceration in the back of the head, and the contusions that the pathologist and the ME found in the back of the brain. And then the brain shifts forward, and as it's traveling at a certain velocity, because it's thrust forward on the floor of the base of the skull, it's getting bumped, and it's getting, again, you can think of it as a hammer hitting a thumb. It's getting black and blue in the areas that are sharpest.
Are there symptoms that result of the process coup counter coup?
This is clinically, it varies. I mean, you can go from anywhere from a simple concussion where you sort of are unaware of what happened, but you're still awake, you're confused, all the way to, ultimately being in a coma.
Can this type of injury, the coup counter coup, and what you see in the review of your files, could this type of injury happen from an attack by a weapon, like a bat or a hammer?
Well, he did not have a depressed.
All I can fucking hear in my head at the moment is cuckoo ka-choo.
Skull fracture. So any focal hit like that would more likely than not have caused a depressed skull fracture.
What about a fist?
Trauma the way he had, the assumption, would cause the coup counter coup without a depressed skull fracture.
When the coup counter coup process happens with the skull fracture, does anything happen to the front of the skull?
Well, you're asking me, does the rest, I mean, the forces, depending on how hard they are, can generate fracture lines all the way to the anterior fossa. So you can have fractures along the lateral temporal area. You can have fractures along the orbital roof. The orbital roof is very thin. And so those forces can go all the way to that area.
Did you see any sign of orbital fractures in Mr. O'Keefe?
Yes, he had both the ME and the pictures taken, and the neuropathologist mentioned fractures of the orbital roof.
Do you have an opinion to a reasonable degree of medical certainty how those fractures occurred?
From the trauma.
Could you just explain a little bit what happened?
Well, as he fell backwards and he struck his head, it was clearly at a very high speed generated by the gravity. The bone, depending on the quality of his bone, the density, then generated forces. There's a certain amount of lateral give, and then you get a linear force going forward. It drives all the way up the clivus and forward into the anterior fossa where his orbital roofs lay. And this is why people like this get what they call raccoon's eyes.
Do you have an opinion whether the brain itself could have caused the orbital fractures?
No. The brain is a soft substance. You could literally put your finger through the brain. We often operate on people fully awake. The brain couldn't possibly cause a fracture. The fracture was caused by the forces generated through that clivus, that middle bone in the middle of his base of the skull.
Do you have an opinion to a reasonable degree of medical certainty whether or not the brain in any way could have caused these orbital fractures?
The answer is absolutely not.
He literally just said that, dipshit.
In your study of the records and photographs and in your experience treating these types of injuries, do you have an opinion to a reasonable degree of medical certainty whether or not a person would remain conscious or would be immediately unconscious after the impact of the ground?
Well, it's impossible to know whether he became immediately unconscious, but his injuries were very substantial. And it's more probable than not that at some point he quickly became unconscious and was unable to do functional activities.
What does functional activities mean?
The ability to, get himself up and about would be one of the functional activities. The ability to call for help would be a very significant cortical function.
So he wouldn't have been able to lock his phone. Like that seems pretty freaking straightforward. He's been hit. He's caught blunt force trauma to the back of his head. So now all of a sudden she's reversing into him while he's walking away from her. Or he's striking his head on the ground. But I mean, how the fuck by the car. And he then stumbles up onto the sidewalk, lands on his back, lacerations caused by the ground. How does any of this work? He's clipped at 25 miles an hour, flies 30 feet across the ground, smacks with the force of gravity with his skull onto the ground. And he's unable to do anything. Except for lock his phone and quietly close his eyes. The prosecution's timeline is a fucking mess.
And that's why I was talking about, that there's a variation on the theme from a simple concussion to a severe concussion like this.
If a person does not have functional abilities because they are rendered unconscious, does their body, could it still move?
Yes, this is the interesting thing about our brain. So the cortex, which is the top portion of your brain, can get separated from your brainstem functionally. And what happens then is that your body is not acting autonomically, meaning vegetative. So why does that happen? We think it's because as we were a caveman, and if a caveman became unconscious, as an animal came up to eat it, the animal would touch it. Well, you have these automatic movements. One of them is called decorticating, which is where you draw your arms like this and you throw your feet out. And then a worse neurological situation is when you decerebrate. Now you push your arms out along with your legs. And that would scare off an animal. So we think that over time, genetically, this is what happened to our brains in order to create these. But those kind of movements are not thought processes. In other words, your brain is not telling you, oh, you have pain, go ahead and decorticate or decerebrate. It's an automatic movement in response to pain.
How the hell
I want you to take us back now to after the fall. Would Mr. O'Keefe, in your study and opinion, have died immediately?
No.
Can you share?
Yes, I'll tell you. There is very few things that you head injury where you would die, quote, immediately. So if I took a knife and stabbed you in the back of your neck right below your skull and I drove it through your brainstem, you would probably die immediately. If I shot you below your ear and went through and through below your ear and shot through your brainstem, you would die immediately. But traumatic head injuries, you would not die immediately. It's a process. And it's a process of a combination of things. Brain swelling, which takes a...
Well, that's just it, because it was, Liam Neeson's wife. I bring this story up every time I can because it freaks me the fuck out to think about it. She slipped while they were skiing, hit the back of her head on some ice, got up, she was perfectly fine. And it was 24 hours later, she just died. Because of the brain injury that developed over time. That's why I'm so fucking paranoid about concussions.
It's a while to develop. Decrease blood flow to your brain because you're getting swelling, and ultimately death of the brainstem that controls your heart and your breathing. And so this is why there's a whole big issue about brain death. When is someone brain dead? Because it's not instant and it can take a long time to be conceived. In these injuries that are very severe that we took care of, there was a high mortality rate. In the linear skull fractures, it was about 67%. But it took time for them to die. It could take days to weeks to months. And also, these people got to shock trauma. So it was a while, whether it was hours, before they were even starting to be taken care of. And yet they weren't dead yet. That's why I don't think it was immediate.
Was there any other observations you made about Mr. O'Keefe or his body that support your opinion that he didn't die immediately?
Well, the medical examiner took pictures of his periorbital area and diagnosed raccoon's eyes. So raccoon's eyes occur because there's leakage through the orbital fractures into the periorbital space. Normally, it takes about 24 to 48 hours to develop. It has been noted as early as 1 to 3 hours, which would make it not immediate.
Could we please have Exhibit 14?
Okay, so that would make sense, depending on how long he was left in the cold for.
Dr. Wolf, could you share with us what you see here in this picture?
So right here, you can see the black and blue that sort of configures if he had his eyes open, like what we describe as raccoon's eyes, right? And that's not caused by direct trauma to his eyelids. It's caused by what I described as the basilar skull fracture, which went to the anterior fossa, which is right over the orbit here, inside with leakage of blood products into that periorbital area.
You mentioned that starts or takes at least 1 to 3 hours to begin.
Minimally, yes.
That's all right. I still saw it.
You take that down, please.
Sorry. Still heard it.
If Mr. O'Keefe had been brought to a trauma center or emergency room, what would the process be in your experience?
Well, he would have been intubated if he wasn't intubated in the field. One of the first things you need to do in a head injury is control the airway. Why? 2 reasons. One, you want to have enough oxygen going to the brain to feed it. And 2, you want to keep your carbon dioxide down because that causes increased intracranial pressure if it elevates. So you want to constrict the blood vessels a little bit. Then he would have had a CT scan immediately in order to assess whether he has a surgical head injury, meaning he needs to go to the operating room to evacuate something or not. During that process, he's obviously going to be getting medication to decrease the brain swelling. And from there, you make decisions based on his neurological function and what you're, capable of doing to, spare the brain from the rest of the injuries that will result. One of the things that occurs with contusions is a great medical term is they can blossom, which means they can get bigger. And if they get bigger, they might require surgical intervention to decrease the pressure as well as the volume of the blood that's destroying brain. And so you do serial CT scans in these patients over time, anywhere from every 6 to 12 hours to on a daily basis, depending on what the case-by-case, production of blossoming is occurring.
You mentioned that about 2/3 of your patients who suffer this injury pass.
Correct. What we saw is that in the patients that suffered linear clavicle fractures, 2/3 of them ultimately went on to die, and 1/3 lived.
Is there commonality on how they pass?
One of the common reasons they passed is if they trapped a major vessel in one of the fractures, they would get a significant brainstem infarct, meaning a stroke, meaning lack of blood flow to a very significant portion of the brainstem. And so that was one of the causes of death that ultimately we understood. And then the others died from the increased intracranial pressure that drove the brainstem down through the foramen magnum.
Did you review any materials that talked about or identified Mr. O'Keefe's body temperature when he was treated?
As I recall, his core temperature was 80 when he was found.
Is that significant in the process and development of his injury from the moment he fell and hit his head until his ultimate passing?
Well, hypothermia, if you define hypothermia, it starts at 95 degrees. Your core temperature is usually about 98, 98.6. 95 is very mild hypothermia. When you get to 82 degrees, you're in severe hypothermia. What happens when you're hypothermic, and I'm a neurosurgeon, but I can tell you that you get into multiple organ failure. Your heart starts to have problems. It can have arrhythmias. You're not breathing. And ultimately, at hypothermia, you also become unconscious and go into a coma-like state. Below 80 degrees, you're probably going to die. So all I can tell you, it wasn't helpful that he had a significant head injury and that he was then found hypothermic.
Is it uncommon in your experience for people that suffer this injury to pass within 5 hours?
Well, none of the patients we treated died within 5 hours, but it also didn't mean that we didn't realize that they were going to be in a potentially vegetative state. When someone's hypothermic, you have to warm them up in order to establish a clinical status, meaning you can't declare someone dead with a temperature of 80. You have to warm them up slowly, appropriately, and then reevaluate where they are clinically.
I've asked you questions about whether you had an opinion about Mr. O'Keefe and when he died. I want to ask it in the form of a formal opinion. Do you have an opinion to a reasonable degree of medical certainty whether Mr. O'Keefe died immediately or within 15 minutes?
No, I don't think he died immediately. Neither the hypothermia nor this kind of head injury would kill you immediately in any clinical experience I have.
Dr. Wolf, thank you.
So, Brennan, walk me through why that helps you.
Let me have a moment, Your Honor. Thank you.
That doesn't change the scenario, though, because he could have just as easily gotten into an argument in the house, whether they beat him up or not. He could have gotten thrown out of the house. He could have walked onto the snow. He could have slipped, hit the back of his head, and then he's died of hypothermia. That's still a plausible explanation for how he's died and how he obtained the injuries that he's got then, based on what the doctor just said. And then the hypothermia ultimately killed him. That didn't help you, Brennan. Come on, I want to get into the cross. I've only got a half hour.
Sir, can you just describe, you started to do it a little bit on direct, a typical day for you?
I wake up at 4:15 in the morning.
Damn.
I go to my center. I set up patients with frames for their either radiosurgical procedures or stereotactic craniotomies. I go home. I make a cappuccino for my wife at 6 o'clock in the morning, and then I get back to work at 6:30 and move on. I have patients that I'm operating on, and I have patients that I'm seeing through the day.
What type of patients and what type of work? Just in a typical day. What are you doing? What type of patients and what do you do?
It varies. I mean, I see patients with brain tumors. I see patients with hydrocephalus, which is water in their brain. I see pediatric brain tumors. I see subacute and chronic subdural hematomas, post-traumatic. I see patients with strokes that are being misdiagnosed. I see patients with cancer, metastatic disease. I used to see patients with cervical problems. I stopped doing that 2 years ago. I don't know what else you want me to tell you.
No, that's great. And is that typical day, typical of the type of days you've had for the past month, past?
No, Jason, honestly, the reason I'm surprised by that is that this guy is physically operating on up to 4 people's brains a day. I was surprised. I would have expected that, 8, 9, 10 hours worth of sleep would have been appropriate for someone that's slicing and cutting into someone's head. I don't know, just surprised me, that's all.
Few years? Is it generally, without specifics, is it generally?
Correct.
So none of your typical days, none of the past typical months have involved forensic pathology, have they? You haven't acted as a forensic pathologist.
I am. If you could have asked that question, very straightforward. I am not a forensic pathologist. I'm a brain surgeon.
Right. And you don't perform autopsies, correct, sir? You're a brain surgeon.
Correct. In other words, I see more brains than the forensic pathologist.
Right. And is it correct to say that the brains that you see are of living people?
Correct.
Okay. So what I'd like to do is to go to a different part of the head than was discussed, but sticking with the deceit.
Excuse me, I didn't hear the last one.
I'm sorry, with the topic is going to be Mr. O'Keefe, the deceit in this matter, sir. You testified about raccoon eyes. The medical term for that, sir, is ecchymosis, right?
Correct.
And ecchymosis, raccoon eyes, does not cause a laceration to form on an eyelid, does it?
No.
Are you aware that Mr. O'Keefe had a laceration to the outside area of his right upper eyelid.
I am aware that the ME described that. Yes, sir.
Now, could, Your Honor, I'm going to, with Your Honor's permission, ask to publish what is already in evidence in a moment.
Okay.
Mr. Wolk,
What exhibit number, Mr. Alessi?
we're going to, 165, Your Honor.
Okay, go right ahead.
Thank you. Dr. Wolf, have you seen this photo depiction before today?
I believe I have.
Is it correct that that injury on the upper right eyelid is caused by the application of force directly to that area?
Yes, Adara, I do have a Discord server, and guys, if you're not getting notifications, that's probably the best place for you to be, because I use Zapier bot to basically notify everybody that's in my Discord every time I go live or a new video is uploaded. I'm not sure whether or not the Discord link is in the description of the video. However, if you go to linktree/Aussie Overlaw'd, the Discord link is, I think it's like one of the bottom links.
Of the front of the head, again, namely the upper eyelid.
That's possible, yes.
Is it more than possible? Is it probable that that injury was caused by the application of force directly to that area of the front of his head?
Well, an easy answer to that would be is that that's not part of the periorbital ecchymosis.
Thank you, sir. That was exactly going to be my next question. This injury is unrelated to any of what you've been describing, the fall backwards, the force transfer inside the skull, the, as you described it, the dura, the cerebral spinal fluid, all of that dynamic that you so ably described on your direct examination. This injury has nothing to do with that, correct?
Correct.
Now we're seeing two surgeons. That was well done.
I have one more moment, Your Honor. Thank you.
Thank you for answering my questions, Dr. Wolf. A pleasure again. No more questions at this time, Your Honor.
Damn!
Follow up on that?
No, thank you.
All right, Dr. Wolf, you're all set. So you can get out of here.
Thank you very much.
Wow. Okay. And see, guys, that's what I meant when I said that guy's testimony was not that helpful for the prosecution. Unless he asked all of 2 questions, because there was nothing he needed to cover on it. If anything, like I said, it was probably helpful to the defense, because it provided reasonable and plausible reasoning as to how John obtained the injuries and how he died. It did not involve the car.
Mr. Brennan?
May we have a moment to inquire of our next witness?
Sure. And one of the counsel inside our jurors, feel free to stand up and stretch.
Yeah, well, they probably allocated a few hours for that guy. But, again, I think Brennan was expecting a lot more to come out of that than did. So all of these injuries, they would not have proven immediately fatal to John, would they? No, they would not. But the injury to the front of his face has nothing to do with anything you just talked about, did it? No, it does not. Yeah, he proved something else happened to his face before the fall. That's exactly it. And if that means that John was smacked in the face by someone, if that means that he hit something else, I mean, I'm sorry, but I don't believe there's any way that Lexus is clipping him in the face causing a laceration above his eye and not doing significantly more damage to his not doing significantly more damage to his body. Like, I'm sorry, the argument just doesn't stack up. God damn, how long was this sidebar? So much for just inquiring of the witness. Who wears a ring? Oh, that's a damn good point. I mean, right side. So we're going left hook. So it's probably someone wearing a wedding ring. I mean, God, at this point it could have been Jim McCabe for all we know. Come on, bring back the boring bitch. Hurry up. There we go.
And then I'll remind you, you're still under oath, and keep your voice up. Thank you.
Yeah. All right, Mr. Lally, whenever you're ready.
Thank you, Your Honor.
I'm glad you're able to follow the instructions to get the LinkedIn, because that, not the LinkedIn, the link.
Ma'am, if you could, just please introduce yourself to the jury again, spelling your last name for the record.
Sure. I'm Christina Hanley. Hanley is spelled Hanley.
And Ms. Hanley, given the break, if we could,
I'd hit her.
a few questions just to reorient as far as the items that we were speaking about yesterday in your testimony. First, starting with the items of glass that you analyzed in this case. The first of those items was an item 3-2. Is that correct?
That's correct.
And if you could, please describe for the jury, or please provide the jury with the description for that item that you received.
Sure. So item 3-2 was a clear glass cup with broken irregular edges. And there was some dirt debris material that was noted on the exterior and interior surfaces.
Your Honor, may I approach?
Yes. Did you show counsel? All right, thank you.
I did, Mr. Jackson. Yes, thank you. Showing you a photograph, Ms. Hanley, do you recognize that?
Yes, I do.
And what do you recognize that?
So this is a photograph that I took. It's item 3-2, but it's also, I would have to double check on my notes, but I believe it has item 7-12, one of the pieces that I'm holding that's showing a physical match between those two items.
Your Honor, call the seek to introduce in a minute the next exhibit.
Okay.
Exhibit 195.
And Your Honor, may I publish?
Yes.
Ms. Gilman, if I could have photograph 9490. Ms. Hanley, what's up on the screen? Is that the photograph that I just presented to you?
Yes, it is.
And if you could, please describe for the jury what we're looking at here.
So that is a photograph that I took upon examination. It is the clear glass cup, item 3-2. And I'm holding another piece, which, again, I believe it's one of the pieces from item 7-12. I would need to confirm in my file, but I'm showing that one of the pieces physically fits with item 3-2.
Thank you, ma'am. Ms. Gilman, you can take that down. May I approach again, Your Honor?
Yes.
I'm showing you two other photographs. You can just get those look up when you're finished. Do you recognize those?
Yes, I do.
What do you recognize those?
So these are photographs that I took of item 7-12.
Your Honor, Commonwealth seek to introduce in a minute the next exhibit, A and B.
Is there any objection?
No objection.
Thank you.
It's a recommended speed limit, mate.
It's 196A and
You don't have to
196B.
do it.
And Ms. Hanley, if you could, just remind the jury as far as the physical description that you received in regard to item 7-12.
Sure. So item 7-12 consisted of some clear plastic pieces as well as 9 pieces of glass with broken irregular edges.
And may I publish, Your Honor?
Yes.
And Ms. Gilman, if I could have first photograph 9476. And if you can enlarge that just a bit, Ms. Gilman. And Ms. Hanley, what are we looking at in this photograph?
So this is the photo that I took of item 7-12 as I received it. So there's the several pieces of clear glass with broken irregular edges.
And Ms. Gilman, if I could have 9477. If you can enlarge that just a bit. And again, Ms. Hanley, what are we looking at in this photograph?
Those are the same pieces of glass as in the previous photo, just a little bit more up close of the clear glass that was recovered and is item 7-12.
Thank you. Ms. Gilman, you can take that down. Now, Ms. Hanley, as far as a comparative analysis between items in 3-2, the glass cup, and 7-12 regarding the glass pieces, what, if any, conclusions did you make in reference to your comparison between those two items?
Sure. So upon comparing those items, I did note that 6 of the 9 pieces of clear apparent glass had a physical match to item 3-2, the clear glass cup.
If you could just remind the jury, as far as a physical match, what does that mean?
So a physical match is basically if an item breaks and those items have broken irregular edges, if those pieces come back together like a jigsaw fit, then it's a physical match and they were at one time together as one larger unit.
Now, as far as each of those items within 7-12 had a letter associated with them, correct?
Yes.
And do you recall which of the 6 were a physical match for item 3-2, the glass?
I would just need to refer to my notes for the exact letters.
Sure, you can take your report out.
I know I shouldn't be shocked, but come on, Bev.
The 6 pieces of glass from item 7-12 that physically fit to item 3-2 were A, B, C, D, F, and K.
May I approach, Your Honor?
Yes.
Well, let me ask you this first. I'm sorry. So, Ms. Hanley, during the course of this physical match analysis that you're conducting, are you memorializing that process with photographs as well?
Yes, I am.
May I approach, Your Honor?
Yes.
And I'm presenting you with 4 photographs. If you could review those and look up on your bench. And do you recognize those, ma'am?
Yes, I do.
What do you recognize those?
Those are photographs that I took upon my examination of items 7-12 and item 3-2.
Your Honor, the Commonwealth seems to introduce in a minute the next exhibit, A to the D.
No objection.
Thank you.
Exhibits 197A through D.
I actually thought it was interesting. I did see a poll on X this morning.
And may I publish, Your Honor?
Yes.
Ms. Gilman, if I can have 9502, please.
Called. I'll be shocked, honestly.
And Ms. Hanley, what's up on the screen? Can you please describe for the jury what we're looking at in this photograph?
So this is one of the photos that I took of one of the breaks that physically fit together between item 3-2 and item 7-12.
And Ms. Gilman, if I could have 9514. And again, Ms. Hanley, can you please describe for the jury what we're looking at in this photograph?
Sure. So this is a photo that I took when I was doing my comparison of item 3-2 and several pieces from item 7-12.
Now, as far as the individual pieces had sort of little white stickers or labels affixed to them, is that correct?
Yes.
Is that something that you did, or is that something that when the items were provided to you was already done?
So item 7-12, I received those pieces with the labels already on them.
And again, those items, especially 7-12, had been with mixed veneer in your unit prior to coming to your table or your station, correct?
Yes.
Ms. Gilman, if I could have 9518. Again, Ms. Hanley, what are we looking at here?
So this is another photograph that I took of the physical match It's just another view of the items together of item 3-2 and several pieces from item 7-12.
And lastly, for this batch, Ms. Gilman, if I could have 9520. And again, Ms. Hanley, what are we looking at here?
So this is another picture that I took of the items, just slightly rotated, of item 3-2 with a physical fit to several items or several pieces from item 7-12.
Ms. Hanley, is there a laser pointer on the desk in front of you?
Yes.
If you could, preferably using this screen just so it's visible for the jury, could you delineate where you see in this photograph item 3-2 and where you see the items associated with item 7-12?
So this
Why
right
does
here
any of this
is
matter?
item 3-2. And these pieces up here.
Was the glass the murder weapon? No. Does the glass on the bumper in any way prove that he was hit by a car? No. Do we know where the glass came from? Yes.
Are several pieces from 7-12.
Thank you. Ms. Gilman, you can take that down. Now, the other two items that
For all we know, they got into an argument. He gets out of the car. She goes to drive away. He throws the fucking glass without her knowing. It shatters, and that's how the glass winds up on the roadway. We don't fucking know.
you analyzed or examined in this part of your physical match analysis were items 3-3 and 7-14, correct?
That's correct.
And turning your attention specifically to item 3-3, if you could just remind the jury as far as the physical description of that item that was provided to you.
Sure. So item 3-3 was 5 pieces of clear glass with broken irregular edges that were recovered from the bumper of the vehicle.
May I approach again, Your Honor?
Yes.
Single photograph. Do you recognize that?
Yes, I do.
And what do you recognize that?
That is a photo that I took of item 3-3.
Your Honor, Commonwealth seeking to introduce in the minutes of the next exhibit.
No objection, Mr. Jackson?
No objection, Your Honor.
Exhibit 198.
May I publish, Your Honor?
Yes.
Ms. Gilman, if I could have 9446, please.
Jesus.
And Ms. Hanley, in addition to the 5 pieces of glass associated with item 3-3, what else is depicted in the photograph?
This is a photo of the 5 total pieces that are from item 3-3.
And in addition to that, is there a ruler depicted in this photograph as well?
Yes, there is.
And what is the purpose of that ruler in the photograph?
It's there just as a scale.
Thank you, Ms. Gilman. You can take that one down. And Ms. Hanley, the last of those items, 7-14, if you could just remind the jury as far as what was the physical description that was provided to you in reference to item 7-14.
Sure. So item 7-14 was a clear piece of glass with broken irregular edges that was recovered from the road.
May I approach again, Your Honor?
Yes.
Yeah, Ms. Hanley, just showing you a single photograph. Do you recognize that?
Yes, I do.
What do you recognize?
This is a photo that I took of item 7-14.
Your Honor, Commonwealth seeking to introduce in the minutes of the next exhibit.
No objection.
All right.
Exhibit 199.
May I publish, Your Honor?
Yes.
Ms. Gilman, if I could have 9471, please.
So
Again.
the two screens don't match.
No.
Thank you.
Thank you, Your Honor. Ms. Hanley, again, if you could just describe for the jury what is depicted in the photograph up on the screen.
This is the photo that I took of item 7-14.
Thank you. Ms. Gilman, you can take that down. So, Ms. Hanley,
If they are paying
in addition to
attention,
the
yeah,
physical match analysis that you did between item 3-2, the cup, and 6 of the pieces that you found to be a physical match from item 7-12, did you also compare pieces from item 3-2, 7-12, and 7-14?
Yes, I did.
And what did you conclude in your physical match analysis of those items together?
So upon examining and comparing item 3-2, 7-12, and 7-14, I had concluded that 6 of the 9 pieces of glass from 7-12 physically fit with item 3-2, and the remaining 3 of the 9 from 7-12 did not have a physical fit to item 3-2. I also compared item 3-2 and 7-12 to 7-14, but there was no physical match to item 7-14.
Now, in addition to that, did you also do a physical match analysis between item 3-2, the drinking glass, 7-12, pieces found from the roadway, and certain pieces from 3-3 from the bumper of the vehicle?
Yes, I did.
And what did you conclude based on that physical match analysis between those items?
So upon examining and comparing those items, so there were 5 total pieces of glass from item 3-3. I used 2 of those pieces for physical match comparison to the items recovered from the road. Upon my examination, I did not, there was no physical match between those 2 pieces from item 3-3 to any of the pieces recovered from the road. So that included items 3-2, 7-12, and 7-14.
Now, as far as the 2 pieces that you had selected from item 3-3, do you recall which of those 2 lettered pieces you chose for your comparative analysis?
Yes.
And which were they?
They were pieces A and B.
And if I could ask why pieces A and B versus other pieces?
So A and B were used for physical match. The remaining 3 of the 5 were not used for physical match comparison due to their size and condition.
Now, those same 2 pieces from item 3-3, pieces A and B, did you then do a physical match analysis between that and 7-14?
I did.
And what did you conclude from that analysis?
I concluded that there was no physical match between the 2 pieces from item 3-3 to item 7-14.
Now, did you also do a physical match analysis between piece E from item 3-3 from the bumper?
I did not. No, I'm not a physical match examination.
Did you do any comparative analysis between a piece of glass E from 3-3 from the bumper and item 7-14?
Yes, I did.
And what did you conclude from that analysis?
So I selected piece E for further examination. I did microscopic examination as well as instrumental analysis, and I did the same microscopic and instrumental analysis to 7-14, and I compared the data, and I came to the conclusion that the piece that I sampled from item 3-3, piece E, was found to be consistent in physical and instrumental properties to the sample that I took from item 7-14.
If you could, Ms. Hanley, could you please explain to the jury when you say instrumental analysis, what is that? What does that consist of?
So the instrumental analysis that I conducted was on the GRIM instrument, which measures the refractive index of the samples. So after I had ran my samples for both item 3-3 and 7-14, I compared the data to determine whether they were consistent or not consistent.
And so when you say that something is consistent in instrumental properties, what does that mean?
So in this instance, they had consistent refractive indices.
Now, in addition to that comparative analysis with the glass items, what other additional examinations did you perform in this case?
Sorry, could you say that again?
In addition to items 3-2, 3-3, 7-12, and 7-14, what other items did you look at in this case?
So I also examined item 3-1 and item 7-18.18.
And what was the description provided to you in reference to item 3-1?
3-1 was a taillight, and there were also some other plastic pieces as well.
And taillight from the same vehicle as the glass from the bumper, correct?
Yes.
May I approach, Your Honor?
Yes.
You have another single photograph. Do you recognize that?
Yes, I do.
And what do you recognize that?
This is the photo that I took of item 3-1.
Your Honor, the Commonwealth will seek to introduce in the minutes.
No objection.
Thank you.
Exhibit 200.
May I publish, Your Honor?
Yes.
Ms. Gilman, if I could have photograph 9394. And Ms. Hanley, do you recognize what's up on the screen as exhibit 200?
Yes, I do.
And what do you recognize it to be?
This is the photo that I took of item 3-1.
And what's contained in here, is that a fair and accurate portrayal of what the item 3-1, the taillight housing, looked like when you received it?
Yes.
Now, as far as, and we'll get to this more a bit in a moment, but as far as any sort of comparative analysis that you did with any other item, what part of this taillight housing were you comparing to that other item?
So there were clear and red plastic portions of the taillight that appeared to be broken. So I sampled portions of the clear plastic as well as the red plastic on the taillight.
And just for clarity purposes, if you could with the pointer, as far as which of these pieces up on the screen were you sampling the clear and or the red plastic from?
So the red plastic that I sampled was from this area. It's a little hard to tell from here. I think I'd have to refer to my photo in my notes, but I think there were a couple of different areas that had clear broken plastic. I think this might have been one of the areas that was broken that I sampled.
And just for my purposes, really.
All right. I'm going to pause that there because we know that the internet gets a little bit screwy when I get close to work. So people, remember, no evening stream tonight, no driving home stream because I'm going to a work conference. So there also will not be a stream this time tomorrow as well. If there is a stream late tonight, so early US morning, I suppose, it'll be... Let's didn't go... to you, what is it? Please remember to place your tray tables in their upright and fastened position, for we are coming to a complete and utter stop. Stay healthy, wealthy, and wise, peeps, and I will catch you all very shortly. Where's the button? There's the button.
And again, on your way out, please do me the favor of hit the like and subscribe button if you're so inclined. It costs nothing. It's absolutely free, and we'll be friends forever. Bye now.
Unfortunately, some members of the media use their platforms to push their own personal bias.
And agenda to control exactly what people think. This is extremely dangerous to our democracy.
This shit, I'm out. Fuck this shit, I'm out. No thanks. Don't mind me. I'ma just grab my stuff and leave. Excuse me, please. Fuck this shit, I'm out. Nope. Fuck this shit, I'm out. Alright then. I don't know what the fuck just happened, but I don't really care. I'ma get the fuck up out of here. Fuck this shit, I'm out.